Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. If you're a woman who has ever thought something is wrong with me, I just don't feel sexual desire the way I used to, this episode is for you. For far too long, women's libido has been oversimplified. Low desire, it must be hormones. Postmenopausal, it must be estrogen. Not interested in sex, let's check testosterone. And yes, libido can absolutely be hormonal. Estrogen, testosterone, thyroid function, metabolic health, these all matter, but hormones are rarely the whole story. Women's sexual desire is influenced by a complex interplay of biology, psychology, relationships, stress, medications, sleep, cultural messaging, body image, safety, and emotional connection. Most often, it's not either or, it's hormones and context, hormones and mental health, hormones and relationship dynamics. And yet, our healthcare system often tries to compress that complexity into a 10-minute visit and a single lab value. There's also a fascinating paradox. While sexual desire tends to decline with age, distress about low desire often decreases. So the question becomes, when is low libido a medical issue, and when is it a normal evolution shaped by life stage, priorities, and circumstance? Today, I'm joined by Dr. Sidhu, a primary care physician who understands that women's health doesn't live in silos. We're going to unpack what really drives libido across the lifespan, what's hormonal, what's relational, what's psychological, and how clinicians can approach this with nuance instead of reflexively reaching for a prescription. Because at Endocrine Matters, we don't reduce women to lab values. We look at the whole picture. Let's dive in. Dr. Sidhu, welcome to Endocrine Matters. I am so excited to have you here. Dr. Sidhu is my friend and my own direct primary care doctor. So this is a super special episode for me personally. And we're going to talk about a topic that is so confusing for so many women, and there's just not enough information about it. So I'm excited to talk to you about women's sexual health today. First, let me give you the floor and just introduce yourself and let everyone know the wonderful person you are.
Thank you, Arti. I'm so excited to be here. I think this is such an important topic that we don't talk enough about, so I'm really excited to dig in. I'm Dr. Sidhu. I am a family practice and a lifestyle medicine doctor with almost 20 years of clinical experience. I'm also the proud founder of Spring Monarch Primary Care, which is a direct care practice here in Houston, Texas. I also teach at a local medical school, and I just love to educate people, women, about how to be agents of their own health.
And she is as amazing as she sounds. So first, let me ask you, tell me a little bit about women's libido. How is it an interplay of hormones, but also biologic, age-related issues, psychological issues, other health issues that may not be hormonal? How does this kind of play out in women's libido?
So one of the many things I love about family medicine is that I get to see people at all stages of life. And what that means is I get to see women as teenagers, young adulthoods, and the longer I practice into perimenopause and menopause. And I have young women complaining of low libido. I have older women complaining of low libido, but I also have menopausal women who have a very robust sexual desire. And when I talk about to the women who have the low libido, they will say, yes, I can get aroused if I'm stimulated or my partner initiates it, but I really never think about it. And my husband gets frustrated, my spouse gets frustrated. So when we start having those conversations like, when did things change? People will start citing a lack of sleep, job change, relationship issues. They stopped exercising, maybe certain medications, chronic conditions. And so what this really tells us that for women, desire is influenced by stress load, emotional connection, and nervous system. Yes, we know that hormones matter, but so does sleep, stress load, relationship dynamics, medications, mood. All these things play into the complexity of women's libido because women's libido is responsive, it is highly intellectual responsive, and it is complex.
So tell us a little bit more about what you mean by responsive.
So a woman's libido is not like an on and off switch like it might be for men. So for men, that's why we have so many medications that work, right? We know that oftentimes it's a vascular issue, almost like an on and off switch. For women, a lot of their libido starts in their brain. It is about how they feel about themselves. It is how they feel about their relationship. And studies show that a woman's body image about herself, regardless of body shape, is a stronger predictor of her sexual desire than her age, the status of her relationship, or any hormones.
That's fascinating. Like, I think we just need to stop and think about that. It's so complex. Now, knowing that it's so complex, how do you even go about approaching this in a clinical encounter with a patient who might be experiencing low sexual desire?
When a woman first comes in and starts talking about libido, the most important thing I'm going to do is help her feel comfortable and proud of herself for having this conversation with me. So if she starts to feel comfortable, because we already know that the sexual desire is related to how they feel about themselves, they're more likely to be open with me. So that's the first step. Number two is to start asking questions. When did this change? When was the last time you felt like your libido or desire was where it needs to be? What changed? And if she starts citing, well, my job changed, things have been strange between me and my husband, or whatever it is, then we know it's more of a lifestyle factor. But if she says, I really just don't know, I feel like it just fell off one day, then I know that I have to start approaching the hormonal aspect. If she starts to mention that maybe it's painful, it's uncomfortable, then I know that maybe there's something structurally. Maybe we're dealing with atrophic vaginitis, which is vaginal dryness in menopause. So basically, her response to the question, when did this change? When was the last time you felt like your libido was where it needs to be, is a really good indicator of which direction I need to go in.
Yeah. And I think also, like, it's a testament to you that women are having this conversation with you, because I think that it's uncomfortable. Like, people don't want to talk about this. And so for women out there who are listening who might be struggling with this issue, one, it's okay to talk to your doctor about this. You can talk to your doctor about this. We're here to listen. But if you don't feel comfortable talking with your doctor about this and you are having a concern about your libido, then you ought to find a doctor who you do feel comfortable, who makes you feel that comfortable, because these are important conversations. It's not just like, well, you're busy and you shouldn't have a libido, right? Like, if it's bothering you, then it's important. And there are doctors out there who are willing to spend time listening to you and talking to you about these important issues. So please bring them up in your clinical appointments. And if you feel dismissed, it's not you, it's the whole circumstance. I wanted to talk to you about who should be evaluated, right? Should every woman be discussed? Like, should her libido be talked about in her primary care visits? Or is it something that's only a problem if someone brings it up? Is it a problem for everybody? Does it change with age? What is your perspective on that?
I think that low libido is far more common than we talk about. Women are embarrassed. They're ashamed to talk about it. As physicians, we don't always do a great job of it. I tell my medical students that by the time you finish medical school, you're going to be great at saving lives, but not necessarily helping patients live a good quality life. And questions like libido are sort of a lifestyle question. So it really goes back to making patients understand that I care about your entire health. I care about the holistic you. So whether your pinky toe is hurting or your head is hurting or your blood pressure's out of control or your libido has bottomed out, I want to talk about that. But when you do talk about it, it's really important to kind of sort of check your position in the situation. So it's important that we help people the way they need to be helped, not the way we want to help them. So I may see a low libido as a really big deal. The patient may not be bothered with it. They may not be in a relationship. They may not have that kind of relationship. To them, there may be other priorities that bother them far more that they want to spend their time talking to me about. So getting an idea of how much of a problem is this in the patient's life? Are they getting ready to try to conceive and they have no libido? That's a big deal, right? Are they in a postmenopausal stage where now they're empty nesters, the kids are out of the house, and the husband thinks that this is going to be a time for them to reconnect, but her libido has bottomed out? That's a real problem, right? But versus someone who is now single, is going through a separation, a divorce, that may not be top of mind. And it's not my job to push that want or that need on top of them, but really assess what's bugging the patient today. What causes them distress about their health, and letting them tell me, and then letting me guide them.
I think this is super important because I think that sometimes either we as physicians come into an appointment, especially when it's pressured and time pressured, with like a checklist of I need to check this, and this. And like we expect the patient to fit into that checklist. Or on the flip side, sometimes patients come into the appointment with an expectation that the doctor is going to run the show. And they end up not having the appointment that they experienced because their doctor couldn't read their mind about what their goals are. And so I think it's really important for both sides to get really clear about what that patient's particular goals are early in the visit, because otherwise we aren't going to address them, and the doctor isn't going to feel like it was productive, and the patient isn't going to feel like it's productive. For example, I've had patients walk into my clinic who have type 1 diabetes, and I'm all ready to talk with them about type 1 diabetes, but they have something completely different going on in their life. Like I had a patient once who had just, before she walked into my office, had found out that her husband was having an affair. And well, type 1 diabetes just wasn't the most important thing to talk about that day. You know, her mental health and how we were going to not let the blood sugars get totally out of control, you know, so that she was healthy through this, was far more important than being like getting into the nitty gritty of her pump. So it's really, really important for us to get clear about those goals early on. And this is where like we need you as a patient to help guide us too, because without you, we just can't know. Are there any particular patients where you notice that this is not as big of a deal or is a big deal and maybe they're not forthcoming about it? Are there any particular populations or illnesses or anything like that where this becomes more of an issue or less of an issue?
I think number one, I think society does a really good job of convincing women that their sexual desire is there simply for procreation. And so if I have a younger woman whose libido is in the dumps, she's more likely to come to me if she's starting to think about starting a family, right? Because it is impeding what her goals in life are. But then I find that women who are a little bit older, who are no longer wanting to have children, one of two things is going to happen when they get out of that childbearing age. Either they are going to continue to have a strong libido and enjoy sexual encounters for connection and satisfaction, or they're going to just kind of let it wane for various reasons and just accept that it's no longer part of their life. And so there's different ages that can make a difference on whether this is a problem or not. But also, if someone is just newly diagnosed with type 1 diabetes or lupus or whatever it might be, that may not be a top priority in their life right now. It may be a body image thing. They may not feel great about themselves and they're not ready to open that box. Maybe they feel like they need to manage their sugars before they can start opening the box about why they don't feel good about themselves. There may be some people who have been really depressed, tried multiple medications, and now I have them on an antidepressant that's absolutely killed their libido, but they don't feel depressed anymore. They may be willing to live with a lower libido. So really understanding what is going on in the woman's life, what their goals are, and what they're willing to sort of let go temporarily or permanently, and what they're prioritizing in their life is super important. But we can't know that if we don't know what else is going on in their life, if we are treating each isolated thing going on in their life as it's in its own little silo.
Yeah. The human body is a system. It's not like a heart and a lung and all these different things. So I think we definitely need to remember to take care of it that way. So I'm an endocrinologist. So of course, I'm going to bring up hormones. And I think it's really fascinating because testosterone use has increased in women over the past couple of years, and it's really been highlighted through social media. And I think that's actually a good thing. I think testosterone can be useful in women's sexual health and for libido, but it's not always the solution. So I would love to hear kind of your thoughts on testosterone, kind of where we are in the world, and potentially other alternative options before we jump to medication.
This is a really good point. Number one, because everybody's talking about hormones. But number two, also hormones have the potential to be overused, misused, and overprescribed. So really making sure that we reassess the patient correctly is important. So it starts with that conversation. And again, to that question, when was the last time you felt like your libido was where it needs to be? And if they can name a life change, a job change, change in relationship status, then I feel less likely that this is a hormonal issue and I'm going to address the lifestyle changes. But if she can't tell me what changed, it's like one day I just feel like it just kind of went away, then I'm more likely inclined to believe that it may be a hormonal issue. And that really depends on, we can do hormones, but we don't need to check everybody's hormones to know that they're in perimenopause, right? So then it's a matter of what symptoms are you having, what kind of hormones, would be best for you. But in my clinical practice, I have seen testosterone solve a woman's libido problems, and I've also seen women not have any change to their libido on testosterone. Because again, the woman's libido is very complex. It's multifactorial. It's not just one on and off switch. It's not just one hormone. It's sort of an interplay of so many things. And so if a woman starts testosterone and her libido has not changed, it's time to address those lifestyle factors. What we don't want to do is we don't want to keep turning up the knob, that testosterone dose, until we get a very robust libido, because we're more likely than not to overprescribe that testosterone and start having side effects that can be really harmful to the patient. So if we just do hormone therapy, we are going to get a lot of side effects. We're going to miss the lifestyle factors. But if we don't do hormones at all, then these women who are just going about they're exercising, they've gotten to couples counseling, they're sleeping more, and the libido's not coming back. Unless we replace the testosterone, it might not help.
Yeah. The breakdown of that is hormones, yeah, sometimes they're helpful and sometimes they're not. So we need to be really discerning about what is causing the low libido. For example, testosterone can have a lot of side effects. It can cause acne, male pattern hair growth in women. It can increase irritability, can cause a lot of side effects that women don't particularly want to have. And it should only be used in normal physiologic doses. A lot of women are on these like sky high super physiologic doses. I've seen women whose testosterones are higher than many of the men in my practice with pellets and stuff like that. So we can use testosterone when it's appropriate, but it needs to be used with caution and monitoring, also with assessment of the whole picture. So along that line, what other options are there for increasing women's libido outside of testosterone?
So fortunately, science is kind of coming along. So we're understanding the complexity of women's libido. So until 1993, we didn't test medications on women. And so women got left out of all these studies. So most of what we knew about libido and sexual desire is what we knew about men, right? So they have 3 or 4 medications to solve their problems. And we're just sort of coming into this aspect of where now we're actually studying women and we're researching, and we have good options, evidence-based options. So number one is sleep. I used to have an attending in medical school that wore a hat that said sleep equals efficacy. If we don't get our patients to sleep, nothing is going to work. We can write medicines till the sun goes down, prescribe hormones till the sun goes down. If they don't sleep, nothing is going to help. Exercise is a great stimulator of libido because it boosts the endorphins, makes you feel better about yourself, and studies support that. One of the strongest predictors of if a woman enjoys sexual encounters is how she feels about herself, irregardless of her body shape. So exercise is super important. And then something that I've been using a lot lately for patients is reading erotica, which I think we'll get into a little bit more, but that has been such a useful tool for my patients. And so the answer of it's okay, just figure it out is not okay anymore. We know too much to say that to women. There are enough evidence-based things that can work for women. And we really need to help them sort of build this toolbox of things that can help their libido, because women's libido is multifactorial.
So I want to talk more about the erotica thing, because this is something you actually taught me. And so tell me a little bit more about that. How much do people have to read? Where do they get bibliotherapy type resources? And how does it work?
So this was really interesting to me. So, for years, I've been seeing women. I've been practicing for almost 20 years. So a woman would come in complaining about low libido, or I would figure it out and we would talk about it. And I would tell them how to change their lifestyle factors, the things that we just talked about, sleep, maybe couples counseling, exercise, and all those things. But I didn't have any specific tools that was evidence-based just for women that targeted their complexity of their libido. So a few years ago, I came across some physicians on social media actually talking about an app that they were building that was based off of reading erotica, which they claimed to be evidence-based for libido, which that was super intriguing for me. So I went back and I dug a little bit, and sure enough, there are studies. Now, they're not the best quality studies. They're small. We need more studies. We need more robust studies, but they're enough to say, hey, this is actually helpful. What they looked at was they gave women a text to read that was erotica text versus neutral text. And what they found was women that were reading the erotica text, it basically stimulated their imagination. Imagination fuels desire. Also, reading the erotica stimulated that thoughtful and emotional component of the cognitive aspect of a woman's libido. So all in all, these studies basically showed that this was not just the same thing as seeing something that was visual or being stimulated by your partner, that reading this erotica was going and stimulating things that are in our brain that, one, make us think about it more often. Number two, use our imagination. Number three, possibly reduce our inhibitions to talk about it, possibly normalize thinking about it. And so now these women who had said, yeah, I can be sexually active with my partner if they stimulate or initiate, but I never initiate and I never think about it. Now they are going throughout their day actually thinking about it. And it sort of becomes the story that they can sort of lead into that intimate encounter.
So fascinating. Did they have any time of day that they were reading it, or duration of time that they were reading, or a frequency or anything like that?
Honestly, so I dug through the data even just to prepare for this podcast, and there was no dose. It just showed that even in those small experiments, just reading erotica text versus not. And I looked at the app that I'm referring to, and they have very short stories. I mean, you can buy longer stories. So there's a free version and then there's a paid version. And the free version is just very short stories that, a woman can read in one text or one sitting. And that is evidence-based to help. So there's no dose, there's no timing. And really the way I tell women is, instead of constantly reading, a lot of us read a lot of nonfiction, right? Things to grow our business and things to become better people and our health and things like that. But take some time if you are having trouble, with your libido, reading these kinds of things and see if it makes a difference. Just keep one of these novels open where you're just reading it from time to time. Patients have told me that's been super helpful. So it's super rewarding when I say, hey, I'm going to say something that's going to feel a little crazy to you, but it is evidence-based and it may help you in the bedroom. So I would like you to try this. And then I'll get a portal message subtly that says, whatever we talked about worked, or they'll come in and they'll give me a hug. And, the good thing is they don't say, well, I didn't read enough, so it didn't help, right? Even just introducing that into their life has been super helpful.
Yeah. So that was going to be my next question. How have your patients responded, and how have they felt about it? Has it been generally positively received? Tell us a little bit more about that.
To me, it's really important to normalize these kinds of conversations. And when you kind of have these conversations with patients, the more relaxed you are, the more you normalize it, the more likely they are going to normalize it. But still, your doctor saying, yeah, go home and read erotica is never going to feel like, oh, this is what I expected to happen today, right? So every single patient is a little bit stunned initially, but the thing is that patients are smart about it, right? So when you say, hey, the studies show, hey, the evidence shows, and they know that no one has given them any better answers, and they can look up the studies themselves or they can try it, it is low cost. It is low risk. It definitely needs to be part of a comprehensive evaluation and possibly part of some other psychological or medical interventions. But it is something that a woman can go home and try while we do the rest of the workup, right? So if I'm going to do labs, because this needs to be said that when a woman comes in with low libido, first we have to be evaluating their medical history, make sure nothing's going on. But while we're waiting on the labs, while we're changing the medications, while she's researching, it's easy for her to pick this up, try it and see if it works. And then by the time she comes back to see me, we know if it worked or it didn't work. And I'll be really honest, I really haven't had a lot of patients come back and say, yeah, that did nothing for me. And the ones that did, it was because they were on some medication that was absolutely killing their libido. And even the patients who are in have issues with their significant other, their desire increases, but maybe their desire for their partner doesn't increase. And that's a good way for them to sort of figure that aspect of the relationship out too.
Yeah, so you mentioned some medications that can drive down libido. And first of all, isn't this amazing? I feel like, we talk about evidence-based medicine a lot, and I think evidence is really important, but we do have certain things that we can try that really have no side effects, like meditation, for example, for people who are having trouble sleeping or who are stressed. There's no side effect. There's no adverse effect. If you don't like it, you just stop it. And there's a huge upside. And so I think that yes, knowing the evidence is really important. Having good, solid evidence when, we're prescribing a medication that someone's putting into their body or doing something that has real potential harm, that is extremely important. However, with some of these lifestyle tools that really have no downside, I personally think that it's okay to try things and see if they work for you so long as there's no major risk. And I think reading erotica and bibliotherapy for low sexual desire in women is one of those things. And, for a lot of women, it does work because after you taught me about it, I started prescribing it to my patients too. And it helps a lot of people with really no downside. And I would say the same with my patients. It really, I haven't had patients say that it hasn't worked. The only patients who it hasn't worked for, in my experience, is the people who haven't tried it yet. And I think it even works in women who are taking medications that can suppress sexual desire. So I think that's really fascinating. But on that topic, what are the big culprits that are commonly prescribed that can lead to low sexual desire? Because I feel like the side effects of medication, especially when related to sexual desire, aren't always told to patients, or patients aren't really recognizing that could be part of the symptom, and they're internalizing, there's a lot of self-blame when it comes to women's libido. So tell me some medications that you've noticed that affect your women.
I would say the biggest offenders for medications that can really impact the libido negatively would be blood pressure medicines and antidepressants. And when it comes to treating the blood pressure or the antidepressant, I know, right? I went to medical school. I've been practicing a long time. I know that it might impact their libido. So it really depends on what I'm treating and how I have that conversation with patients. So if a woman comes in and her blood pressure is 180 over 110, I'm going to pick the best blood pressure medication for her that's going to help us get to goal as quickly as possible, knowing in the back of my mind that this may be an issue, particularly like beta blockers and maybe even amlodipine may impact their libido. I might choose something that has a lower risk, one of the newer beta blockers, especially if she's young, especially, if that's been an issue for her. I may not mention it outright to a patient because I want to put out the blood pressure fire first. When she comes back in, if she mentions the libido, this is an important, thing for patients to take away. If you're noticing these kinds of side effects, talk to your physician about it when you do a follow-up. But I may mention it to the patient, say, hey, has this changed your libido? Or she may bring it up. And at that point, I can say, hey, look, your blood pressure looks amazing. This medicine is working really well, but I don't want to sort of shut off one aspect of your personality and your quality of life just to treat your blood pressure. So these are other options. But on the other side, when it comes to prescribing mood medications, particularly SSRIs, they are notorious for absolutely stunting libido. And that might be a more proactive conversation that I have with patients. And the reason is because, low libido, lack of libido may be a symptom of their depression. And I hate to just, do away with their depression, treat their depression, and they still had that symptom or it's worse. So depending on the age of the patient, depending on if they've already complained to me that libido is an issue, maybe their depression is causing, relationship issues, and this may exacerbate those relationship issues. So then I have, that conversation. Hey, I think escitalopram will be great for your depression and it will work quickly, but it will blunt your libido. Versus I have these two other medications, bupropion and duloxetine, which are libido neutral, but these may be the side effects of those. What are your thoughts, right? So that pulls the patient into the conversation. Maybe libido isn't a high priority for them. Maybe just not being depressed is a high priority. Maybe they've tried duloxetine or bupropion and they absolutely hated it. So really offering up sort of that information to patients in a controlled setting that is evidence-based and guiding them based on your clinical knowledge and your expertise can help patients make a good decision without us as the physicians just throwing it on them. But those are I would say the blood pressure management and mood medications are the two biggest offenders for libido for women.
Yeah, I think so too. And I also think that different people are affected differently. I've had women on SSRIs who, they say their libido is completely flat or they have delayed orgasm or things like that. And then I have women who are like, no, like they don't notice any change too. And so part of this too is when you're prescribing a medication, the last thing you want to do is make patients fearful of a medication that can truly help them. So our jobs as physicians is also to kind of weigh the risks and benefits of these side effect conversations. Of course, we want to inform our patients of potential side effects, but we don't want to hammer those into a point where the patients don't want to take a medication that they really need to take at this point for, like in the instance of high blood pressure, like you mentioned, we don't want them to have a heart attack or stroke or something like that because they're afraid to take their medication due to libido issues, which we can address in the future. So, Anu, what about oral contraceptives? Do they affect libido?
That's a really important point because oftentimes women who are on oral contraceptives are younger, and we expect younger women to have more of a higher libido or more of a sexual desire than older women who are in postmenopause and menopause, but they may not. And the truth is that, yes, oral contraceptives can impact libido and lower libido. They can lower arousal. They can cause delayed orgasm. And that's a really important point to make. And if you think about it functionally, it's when you are on oral contraceptives, you are not ovulating. And a peak woman's desire or libido is highest when she's ovulating. That's sort of due to procreation and evolution, so that you're more likely to get pregnant at that time. And if we aren't having women ovulate, if their estrogen is staying lower, that may just completely blunt their libido. It may cause vaginal dryness many years before they expect it, but they don't know how to talk about it because no one in their friend group is talking about it. So if you've been prescribed oral contraceptives, talk to your doctor because we do have different options with different levels of hormones and different types of hormones that can kind of help restore your libido. You don't have to just stick to the one that isn't working for you. And killing your libido is an example of something just not working for you if that's important to you.
Yeah, and oral contraceptives can have an effect on mood too. So if your mood is off, then that can affect your libido too. So there's so many options for contraception when it comes to orals. There's so many options of orals, but there's also implantables. There's marine. There's so many options. So if one is not working for you, definitely talk to your doctor about other potential options. So what else? Are there any issues related to women's libido that we haven't talked about, haven't covered, that you think are really important that you want to make sure we talk about and have available to women in this episode?
I think that one of the most important things we can understand is how different a woman's libido is to a man's libido. Okay. For men's libido, it is almost an on and off switch, right? We can give them the medications that, dilate the vessels and they're fine. Or we can prescribe them testosterone and they're fine. For women, there is so much cognition. There is so much intellect that goes behind it. So many emotionals, not just how they feel about their partners, but how they feel about themselves. And so it's really important for us to stop looking at it as, like a his and her, like is the same thing, that these are two completely different sides of a coin. They're not even related. And so if we keep talking to women like we're talking to men about libido, we are going to always miss the mark. And I think it's really important to understand that whether you read erotica or you read self-help, what it all really comes down to is that your stress load is manageable, that you have a good body image of yourself, regardless of your body shape, your age, your relationship status, and everything that's going on, that you have optimized your other chronic conditions that might be involved, that you feel safe emotionally, physically in your relationship, that your nervous system is relaxed. And unfortunately, we're complex human beings. And if we just target one thing or another, it's going to feel frustrating, but that's not your fault. It's because we've done such a poor job of explaining to women how complex the woman's brain is when it comes to libido. And I think that when we arm women with this knowledge, they can actually do something about it, because all they've ever known is my husband gets to take a pill and he's fine. And, there's pills out there and they don't work that great and they're expensive and they have side effects. So like I'm the problem. And I think when we start talking about it, having conversations, doing podcasts like this, we really arm women with good evidence-based knowledge so that they can take this into sort of their own hands and maybe ask their doctor to help and work as a team to sort of alleviate the distress that may be around a low libido.
So I went to Northwestern as an undergrad, and there's this super popular class that I had the opportunity to take called Human Sexuality. And one of the first things that our professor talked about was the differences in male and female sexuality. And it will always stick with me that he said men are very visually stimulated and women are just not. So that's why men can like look at pictures or look at their wife or look at pornography and feel stimulated, where women, like, that does nothing for them. And so I think, or they're grossed out by it, by it. And so I think that remembering that they're two different things, so the expectations shouldn't be the same of what turns men on versus turns women on. Like, we just need to be addressing them as two different things. So I love that you talked about that. And the other thing I want to make sure that we address is libido is not the same thing as physical pain or symptoms or, vaginal dryness or painful intercourse. So those things can lead to low libido. Pain can make people negatively associate with intercourse and therefore cause low libido, but they're two different things. So they really do need to be addressed in two different ways. And I think, Anu, you were kind of alluding to that when you were talking about how other medical diagnoses have to be ruled out. But I think that for this conversation, we're really talking about libido, like the more mental side of sexuality, not the physical ability to have intercourse with pleasurably and without discomfort. So if you are having those symptoms, those are also important to address with your primary care doctor or OBGYN and to have treated, worked up. We do have a lot of different ways to help with that too. But this conversation is more about libido. So thank you so much for coming on. If you have one key takeaway from this episode, what is it that you want all women to hear about libido?
If I were to give women one piece of advice, it would be give yourself permission to seek professional help if this is causing distress in your life. It's okay. It's a part of the human existence. To us as medical doctors, it's like you having a headache or your stomach ache or you just feeling tired. That's what we are here for, is to help you feel healthy, to feel better. And so just give yourself permission to think about this, talk about this, and not be ashamed about it, because I find that for so many women, inhibition is the bottleneck. And if we remove that bottleneck, we start talking about it. Maybe you start talking to your friends about it, your friend, like people in your close mom group. Maybe you start talking to your doctor, and we sort of open up these conversations and stop having them behind closed doors and feeling embarrassed about them.
So Dr. Sidhu mentioned distress, and distress doesn't have to mean like divorce, right? Like it doesn't have to be reaching the point of like no turning back, things are really bad. Distress can be smaller than that. If it's uncomfortable for you, or you don't have the desire that you wish you had, even if your marriage is fine, your partner is super understanding, like all of those things can exist at the same time as having low libido. So don't wait to discuss this until things have gotten really bad. Discuss it when it's relevant to you. Discuss it early before those downstream effects happen, and you're more likely to be happier, healthier, and have a good sexual relationship if you do bring it up early. I think this was such a great episode and such a topic that a lot of women are nervous to talk about, embarrassed to talk about, and something that affects a lot of women. I talk about, sometimes it comes up in like mom conversations, right? And it's pretty ubiquitous. People struggling with libido issues, they just don't want to talk about it, and for good reason. But it is also something that is fairly changeable for many, many women. And sometimes it doesn't include a lot of medication, and bibliotherapy, erotic reading can be really, really effective. So I hope this episode helps a lot of women. Dr. Sidhu, where can people find you?
So you can find me on Instagram at anu.sidhu.md. I'm also on TikTok with the same handle, YouTube, Anu Sidhu MD. And I've been hanging out on Threads a lot. I've seen a lot of good, interesting conversations on Threads. And then my website for my practice is www.springmonarchmd.com. Pretty much everywhere that you want to look right now. And because I just feel like putting all this information out there for women to grasp where they're hanging out is so important, kind of reach them where they're at, rather than waiting for them to come to us.
Yes, for sure. And like I said, Dr. Sidhu is my actual PCP. So if you are in the North Houston area and looking for a wonderful primary care doctor, she is accepting patients. It is it is March of 2026. So I don't know if that's going to be for forever, but she is as of now. So check her out if you are looking. And you guys know how to find me. I'm at Dr. Arti Thangudu on Instagram, on TikTok, and our website, if you want to see us in clinic, is sacomplete.com. Thanks so much for being with us today, Dr. Sidhu.
Thank you.